Well, hello everybody. I love this conversation. All about health, well-being, being in nature and gardening. It's time for this week's episode of Tree Lady Talks. So welcome to Dr. Richard Claxton from Gardening for Health. Dr. Richard, it's so lovely to see you.
Oh, thanks for having me, Sharon. It's nice to see you too.
Tell me about yourself. Tell me about your background, please.
Right. I'm a GP. I've been at my practice in Tunbridge in Kent for 21, nearly 22 years now. And before that, I worked in paediatrics as a junior doctor and did my general medical training in London. But I'm sort of mad keen on gardening. I have been really for as long as I can remember, especially sort of finding the benefit of it for my own well-being during my junior doctor training, where the hours were pretty punishing. It was really nice to be able to spend some time outdoors. I've never been that much of a gym kind of person, or that's
nor me.
But it's quite. I recognised quite early it was a good way of keeping relatively slim and trim, in a gentle way that really suited me. So I've basically done it ever since, really.
Well, I think many of us will have watched on TV or read the book. I've done both. This is Going to Hurt by Dr. Adam Kay, and it really did portray how punishing the hours are. So I think getting out in nature, I mean, I overwork, and so I have a garden and I work outside, and I find it kind of slows down my mind. So that's really great. I actually wonder about if we've got a connection that we hadn't realised about. So are you in the new medical centre at Tonbridge in Kent? The brand new one?
I'm not. I'm in one of the older ones. It's an old practice. We're in a Edwardian building. There is a new build practice for one of our local neighbouring practices.
Because we saved a horse chestnut tree next to that practice.
Yes, I heard about that.
There's a podcast about that, Conquers Not Concrete.
Yes.
And the most wonderful local residents there, and a really great developer who was open to what we wanted to do. We actually worked for the developer and were able to save the tree through technical work. So a little bit of a link there that I just twigged. That's great.
Yeah.
But going back to the benefits of gardening, everybody thinks, gardening's good for you, and it is, and it's really great how on mainstream TV programmes such as Gardener's World, they talk about your well-being. But, I mean, you're a GP, so let's talk about the physical benefits of gardening for now. I guess during your day-to-day consulting, you see many different people coming into your consulting room with various ailments, but anecdotally, first of all, have you noticed there is a link between better well-being, better physical health, and for those who are active outdoors, gardening, for example?
Yes, massively so. Gardeners are something like 60% less likely to be overweight or obese than non-gardeners. One example is that the calories that you burn, the energy that you expend in 3 hours of gardening is equivalent to 1 hour of much more vigorous work in the gym, and in particular with older people who are becoming more frail, the act of gardening, the movement around, the squatting, the standing, the leaning, the reaching, all helps with balance and coordination. And so there's that side of it, and then there's also a more biochemical one with vitamin D from sunlight and sunshine and exposure to the daylight. You've got me started now, Sharon. I'm going to go down.
You can carry on. You can be as medically technical as you like, because I love it.
So vitamin D comes from the sun reacting with certain chemicals in our skin, and that helps with our general well-being. our bone strength and our muscle strength, to name but a few. What else? There's we'll talk about the soil stuff shortly, but there's also various other physical theories to do with coordination and core postural strength, muscle tone, etc., etc. So there's lots of
I totally agree.
Physical side of it, yeah. And we all know that kind of that good ache when you've come in from a day in the garden and you know you've worked hard and you can feel it's done you good physically because you're tired. So that's
it's a lovely sort of tired. It's so much nicer tired than the tired. I mean, I feel utterly exhausted when I've spent a really long day in the office here doing hundreds of emails and report writing and problem solving. But if I've been out surveying or if I've been out working in the garden, it is a good sort of tired rather than the bad sort of tired that you get at the end. Aside from the physical, I know that the mind and body are linked, but tell us about some of the mental benefits that we get from gardening that you've observed in patients.
Yeah, I mean, I'm just trying to think how to organise the answer for that, because there's the sort of pure psychological side of things and the meditative or the mindful side of it, which I personally really feel. So it just allows me, when I've got a head that's full, to go and focus on something that might be very, very simple or straightforward, a repetitive task, potting on seedlings or something like that, that just allows you to think about it without thinking about it, if that makes sense. And
totally, I know exactly what you mean.
And that can be really, really helpful. And I've always found that there's something psychological about what I'm doing in the context of what gardeners have always done and what human beings have always done since we've been growing crops and since we've been growing flowers. So there's something, there are days when my work is really stressful or there are other things that are worrying me. But there's a sense that I'm doing stuff out there through the seasons, through the year, through the life cycle of each plant, through my life cycle, that puts into perspective my problems in the context of the world at large. And actually that's kind of liberating, because you realize that actually potting on these seedlings has been something that my grandfather did before me, and he showed me how to, and his grandfather did, and countless grandfathers and grandmothers back have done the same, and God willing always will do the same. And then you start to think about your place in time as well as in the world, and that's a leveler. It's kind of reassuring about your stress because it puts it into perspective, and it feels almost sort of humiliating and making you feel small, but it's the opposite. It kind of makes you feel free. So that helps for me at a psychological level. There's something primitive about humans that have, we've spent, if you look at the human lifetime, I don't mean as individuals, but as a species, we've spent something like 99.9% of it in the outdoor world, in the natural world, learning how to be hunter-gatherers and to feed ourselves and living with nature. And it's really only the last 0.1% of the human species lifetime that we've been turning our back on it. And so it's really since the Industrial Revolution that we've started to live in sort of insulated boxes and spend our days looking at screens and doing all the stuff that we know goes counterintuitively to what we were developed to do. So I think in lots of ways what we're doing in the garden and with nature and with wildlife and biodiversity, especially with the planet in the shape it's in, and the climate and the species changes that we're seeing, that reconnects us. So that's another dimension to it that I really value. I also value looking at the garden and thinking, wow, it looks great when I've spent a load of time out there, but I have to say that the percentage of time I look at it is much more, oh wow, it's looking awful, and I've got to do this, that, and the other. And I've got a big garden, so the balance between the burden of it, actually, I'm quite aware of now. So I moved from one area of neglected garden to the other, and it's a balance of how neglected I can leave each bit. Do you know what I mean? Rather than,
I think they call it rewilding now.
Yeah,
it's incredibly
okay,
trendy.
Thank you. Excellent. So yeah, lots of ways psychologically. We know the biochemistry as well, because we know that we talked about that good ache, and that connects psychologically because that releases endorphins. Endorphins are the chemicals in our bodies that are released by physical exercise, and they have a similar effect on the mind as opiates. So a bit like codeine or morphine, they can give you a little bit of a high, which is why people get kind of addicted to going to the gym, apparently. So that's something there, and so do there's another chemical called serotonin, which we know is enhanced in gardeners who've been in contact with the soil. So
so much to unpick from that really great answer. I mean, just going back to a really good point you made about it being part of our evolution as human beings, and the fact that it's only very recently that we've lost that contact. I had I do refer back to it because for me it was such a powerful conversation with Professor Roland Ennis, who wrote a book called The Wood Age, which really just took us through from prehistory to the current day, and just really thinking about, we are designed to move. And we're designed to be outside. We need vitamin D, so that's a bit of a clue, isn't it? And we're designed to do things with our hands, with the soil. So I absolutely agree with that. And something else that you said, which also chimed with me, was the idea of connecting through the generations. Now, some people actually have their family's garden, but even if they don't, they might have the memory of growing up as a child and watching a grandparent, pot on, or maybe they've got some tools, or maybe they're continuing a family tradition. And I think that's also very grounding. I really think grounding in all sense of the word, that you've got that connection to the family. And the other thing that you said, which really, really is so true, is the repetitive nature of some tasks. And how good that is for us. Like, we're super busy here, as you are. Super busy life and busy social life as well. And a couple of weekends ago, Noel and I worked in the garden together, and I was mulching and weeding. And sometimes I listen to stuff, but I thought I don't want to listen. I can't listen to any podcast or any music. I literally want silence. And I just want to do, and I was there for 3 hours, and it was brilliant. And I've got so many people are struggling now with poor focus and concentration, and overstimulation. And I find gardening absolutely wonderful. So it's just such a simple thing to do. Of course, not everybody has a garden, do they?
No.
But we can come on to that, because, there are things you can do even if you've got a flat with a windowsill.
Absolutely.
That's absolutely great. And one of the things that I've noticed through this excellent, you started this excellent website. So let's go to that now, before I talk about the social side. So tell us about the website you started, why you started it, what it is, and what people can find there.
Sure. So it's a really, really simple website. I'm not a web designer by any means, and I didn't get any help making it. So that was a learning point for me. But it's basically just a map, and it's a map of England, Wales, and Northern Ireland. and I'll come to why it's not got Scotland, but it's a map of all the therapy gardens in the country. So I was wanting, as an enthusiast, I was wanting to find out where I could refer people in my consulting room if there was a scope for therapeutic gardening locally to us. I wanted to find out where it was, and I realised, number one, that there wasn't anything near us in Tunbridge, but number two, that the process of finding out wasn't easy either. So in order to make it easy for either GPs like myself or members of the public who wanted to find out if they could get referred to for help or go and volunteer at gardens that are in their neighbourhoods. So you can go to the website and you can zoom in on the map. Unfortunately, because it's the basic model, it hasn't got a postcode search thing. That costs extra, I gather. But it's basically, you just zoom in on the map, find your neck of the woods, and it's got lots and lots of little green flowers on it. Each flower is you click on the flower and it takes you to a description of the garden with a hyperlink to the garden's website. And so if listeners to the podcast are able to have a look at it and see what's in their neighbourhood, see what's missing as well, because I rely on people using the contact form to keep me updated. If they can see something that's there that shouldn't be there, or something that isn't there that should be, then please let me know. The website's called www.gardeningforhealth.co.uk, and it's with the number 4 in the middle.
It's really good. I went on it and had a look in my area. I'm just too remote to be near anywhere. But I know it's absolutely great. And you can just, as you say, click on the link. And it struck me that there are a lot of these therapeutic gardening clubs around.
Yeah.
And I think there's something about being with a group of people and actually doing an activity together. And it's really helpful. Like, I do a lot of my consultancy practice in London.
Yeah.
And to see community groups who live in tower blocks getting together and doing gardening. And it's a really powerful and encouraging movement with people growing all sorts of exotic vegetables as well.
Yeah.
So I think there's that social aspect. And I also think that the learning new skills is really good for our neural pathways as well, don't you?
Yeah, absolutely. We talked about repetitive tasks as well. And in particular, if you're in a therapeutic setting, so you've got someone who has a particular healthcare need or an emotional difficulty, or, for example, something like a social communication problem. They may be neurodivergent, so someone like autism. If you are, as a therapist, if you sat down in a room with someone and you maybe wanted to make eye contact with them and talk about things, then they might find that very, very difficult. Whereas actually, if you've got someone who's relatively withdrawn and finds it difficult to communicate with people, and you're focused on a task like putting on seedlings, then it's extraordinary how that diffuses the anxiety around the communication, because you've got a simple task, you're thinking with your hands, and you're thinking about what you're doing with your hands, I should say, and that kind of allows the right brain and the left brain to sort of separate from each other, and it kind of allows you to reboot yourself, but it also means that you can focus with the patient on the task, and that's amazing how much easier it is for them to start saying about what's going on in their world, what's worrying them, what the problems are. And so from a horticultural therapy point of view, that can be really helpful too.
That's wonderful. And I was privileged to be involved with a 10-year project at Broomfield Hospital, which is an acute hospital in Chelmsford in Essex, as part of my consultancy role. And without talking too much about that very broad project, one of the aspects of that was volunteering. And one of our partners was MenCap. And so MenCap would come along to the woodlands and to the open space there And as well as doing coppicing tasks, etc., we set up a gardening area and they grew vegetables. And I learned so much from those wonderful clients of MenCap.
Yeah.
And it was such a joyful experience. And it went on for a long time. I believe it's still going on now.
Yeah.
And there was something about the freedom that they felt and the confidence that they felt for handling a bow saw for the first time. But actually getting their hands dirty, it's just, it was really utterly joyful. Yeah. And so many multiple benefits.
If there's a subject you accompany a walk, you'll probably find it on the Tree Day Talk.
This episode is sponsored by Ruskin's Trees and Soil Biology Limited. Well, we've been talking about soil in this podcast, and Ruskins really care about healthy soils. They have a soil lab section in their business, which uses a specialist compost tea full of natural, healthy ingredients to boost soil health. Because healthy soil means healthy trees, be they trees you've already got in your garden or newly planted trees. And not only that, I know from personal experience of working with Ruskins that they're brilliant and careful when they air spade around roots. And we worked together to move a really precious tree. And it's grown really well after transplantation, and it was not an easy job. So if you want to find out more, visit their website ruskins.co.uk, and also they'll be given a demonstration at our conference, Trees, Planning and Construction. You can hear more about that at the end of this episode. So we know it's all really good for us, those of us with all sorts of different issues, or those of us just a bit overworked. What is the situation with social prescribing in the UK on the NHS?
Okay, so
it's a big question.
Yeah, it's a big question. I'll try and answer it as succinctly as possible. There is supposed to be a social prescriber attached to every GP surgery now in the country. There are a few small number exceptions to that, but in general, there should be someone who is a social prescriber or a social prescribing link worker who's in your doctor's surgery who can direct you to whatever is going on around you. So this is so I'm just thinking about my town where I work in Tunbridge. We may be directing people to a day centre for the elderly, or lunch clubs for people with dementia. They may provide support and advice and guidance for carers who need, who may be feeling a bit overwhelmed. They maybe need some respite support. They may have an idea from a mental health point of view about a cafe that's running out of the Mind branch, or a befriending service that's running through Age UK. So it's a range of things. It's kind of all that slightly, I'm not going to use the word soft because it's not, but it's different to the kind of core knowledge that leads to a more traditional prescription. So a medical prescription, be it for physiotherapy or for a tablet or a course of treatment. So it's more about community, and it's more about connecting people. A lot of the time, that's connecting people with charities or church or temple groups, things like that, things that are going on that don't have a kind of price tag in the same way that the traditional prescription. And part of me is a little bit cross about that, because politically, I think we sell that third sector, as it's called, a little bit short. There's a kind of, it's part of NHS policy, it's part of the government's drive to increase social prescribing, but the resources for it aren't being bolstered at all. So when I do a prescription for, let's say, a course of antibiotic or a course of treatment, then that carries a price tag. So that goes to the chemist who dispenses it, the guy who drives the van to deliver the drugs to the chemist. That company gets a slice. the manufacturer gets a slice and the government gets a slice back as a prescription charge. Whereas a social prescription is a little bit of a con insofar as it's called a prescription, but it's really just a signposting. And it would be lovely if there was a little bit of policy. I don't want to get too political here.
You can be as political as you want to. It's your call.
It would be nice if there was a little bit of money that followed that social prescription, so that the charities that are helping out the state sector get a little bit of support in doing so.
Well, that sounds very sensible to me.
Yeah. So that's what a social prescription is. And in Tunbridge, what we've done is used the social prescribing workers to actually run a therapy garden. So we've got 2 of them, and they're employed and do some work on allotments with patients with mental health problems or physical health problems or learning disabilities, or even just loneliness and isolation, and they work for a course of treatment over a 12-week period with patients who are referred.
Well, it just sounds so wonderful, and actually it's just replacing the life perhaps we used to have a generation or so ago.
Absolutely.
And it's people are just really, really benefiting. Yeah. And interestingly, in some of my work on social housing estates in London, forgive me, listeners, I do refer to my own work, but it's what you know. I have come across a huge sense of community in those housing estates where they've got the open space, and many of them, not all of them, will be working on those areas.
Yeah.
And a real sense of personal pride. And I found that again in this small village, but nothing else in between has really had that sense of community for me. And people are just happier. I actually think I live in a blue zone.
Okay.
Now, but I hadn't noticed it in a small town that I lived in for a long time, or another village I lived in fairly recently.
Yeah.
So I think it just makes people feel good, and hopefully healthier as well. Have you found that by social prescribing for being outside in nature, for gardening, with your particular patients, have you been able to reduce the amount of prescriptions for mental health conditions?
I'm not sure that we've got enough data on that as yet in Tunbridge, but I can tell you, Sharon, there's definitely data on that. In that studies have shown. So in July this year, a study, a group of 5 studies actually were published by the wildlife trusts in this country, and they had done 5 sort of pilot programs where they looked at the cost to the healthcare system as a reduction when they put in place certain interventions with individuals. So, for example, I think it was Doncaster, they looked at a small number, less than 100 people, but they were people who used a disproportionate amount of healthcare budget because of their illnesses, or because of their behaviour or addictions or mental health or whatever, a whole range of things. So they're known in the business as frequent flyers by health service managers. We GPs tend to call them patients, so they looked at that, and they produced an enormous amount of money saved per capita of those frequent flyers per year. So there are reductions in both prescribing, but also in the number of appointments that they have, the amount of attendances at A&E, things like that, that you can demonstrate if you want to. There was one slightly more grandiose claim. This was about 8-9 years ago, that for every £1 that you spend on horticultural or green therapies, you could see £6 saved in healthcare spend in general. And the logic for that is not simply in the moment, it's not simply short term, it's more about lifestyle change. And there's a huge amount of prevention. So if people start to to grow their own vegetables, for example, then that's not just about the act of gardening and the physical benefit of the process. They're actually then taking home vegetables from our therapy garden that they're then learning how to cook. So they're maybe used to a more sort of fast food based diet or processed foods, and then suddenly they're faced with a sweet potato and an onion, and they've got to for the first time possibly start to learn how to prepare that as a meal, and then that then starts a whole line of dominoes toppling for those people in terms of lifestyle change. That's even before you start to think about the ecological benefits. So we're no longer importing sweet potatoes from Peru. We're growing them for ourselves. Do you see what I mean? So
I see what you mean. I'm actually struggling to keep quiet because I'm so excited by this domino effect.
Yeah.
And what you can unpick from that. So let's just take that example of somebody who may have been sedentary and may be in an urban area, may have had a diet of takeaway food or whatever. And then they start growing something, perhaps with a group. They take home the project. So they've got the social aspect, they've got the physical aspect of the doing.
Yeah.
They've got perhaps neural pathway growth as well.
Yeah.
And forgive me, I'm not medical, but I'm fascinated by the brain. Then they come home and perhaps they learn to cook something fresh for the first time. So they're learning a new skill then, and there's a physical act of doing. Then you've got like the physical benefits of eating something fresh, eating something in good soil, the soil microbiome we'll talk about in a moment. And then, so you've got the health benefits of increased nutrition, increased vitamins and minerals and fibre. And then they might feel really great about it, you know. Then there's a whole self-esteem and I think it's absolutely wonderful. And maybe it's cheaper too.
I'm sure it is. And and that's, you know, then if you think about the local geography so if you've got a community garden, then that might be in a brownfield site in an urban area. So you've then got an impact on the local biodiversity and the local ecosystems, plus the societal benefits of lonely or vulnerable people making connections, thinking about their communities differently and working together, both with each other and with volunteers and the staff. And then the other dimension to it that we're finding is that it's actually proving a springboard for people in terms of their career development too. So we've got two of our patients who've been through the program are actually looking at horticultural careers going forward. So, you know, and these are people who've been long-term unemployed or out of work through ill health. So, you know, there's so many wins. It's hard to keep up.
Wow.
Yeah.
No, that's so good. And actually, horticulture really needs more people coming into industry, as does arboriculture. I talk about that. But I was speaking to an eminent horticulturalist. I won't name drop on this podcast, but somebody who just said, we are desperate, you know, and I just think it just lifts people's motivation as well. It's good. And of course, low food miles.
Yeah.
Something else.
Absolutely.
You know, it's not packed in plastic and it's come from Peru.
Yeah.
So no, that's absolutely brilliant. One of the things we talk about with trees, with arboriculture, is we need good soil.
Yes.
And that it's a whole world beneath our feet of soil microbiomes and mycorrhizae fungi and nematodes and, you know, the real nutrition in the soil. It's a living, wonderful, much misunderstood ecosystem.
Yeah.
A lot of our soils are very depleted, but for those who are healthy, when I was a little girl, I have a clear memory of being about 3 years old and rolling my mum's raw pastry in the garden on the soil and eating it. And my mum going, oh, what are you doing? And I now think, good on me, you know, because there is a connection, isn't there? Between a bit of soil and non-communicable diseases. Perhaps you could just explain to me as a non-medical person how that works.
Well, so there's a whole massive amount of microorganisms in the soil. I think the statistic I remember is that there are something like 3 billion different bacteria in a teaspoon of soil. Basically, we know that contact with them in the soil is something to do with so-called the gut-brain axis. There was an amazing study done at the Marsden Hospital, and that was with a lady, an oncologist called Mary O'Brien. She had.
Oh yes, I've heard of this.
Yeah.
Yes.
So she identified. Well, it had already been identified that a particular soil bacteria called Mycobacterium vaccinii, which is quite similar to TB, the bug that causes TB, and they'd given it at I think at the Brompton Hospital to the respiratory patients there with TB. They'd given Mycobacterium vaccinii as a treatment, and it had got them better. So Mary O'Brien had a group of patients with very poorly with lung cancer, with a poor prognosis, and she thought, well, let's see what happens. And so they gave them Mycobacterium vaccinii, and what happened was, unfortunately, the patients didn't improve their lung cancer outcomes at all, but they did improve the quality of their life, and all their psychological rating scales were improved, their mental well-being, even though they were facing the end of their lives, their psychological outcomes were much improved. And subsequently, we now know that Mycobacterium vaccinii has a direct link to serotonin levels in the brain. So if you come into contact with it, there's something that it has a kind of. I'm a GP, so I don't do the really, really high level science, but there's something in the cell wall, a protein in the Mycobacterium cell wall that actually leads to a increase in serotonin production in the brain. Serotonin is a transmitter that communicates from one cell to the other in the brain, and we know that it's linked to levels of anxiety and levels of happiness. So the most common used drugs for depression are ones that improve serotonin levels in the brain. So we think that's how that works, and that's why most of the time I garden without gloves.
I garden without gloves, and no, I absolutely agree with you. And they also say something like 3 Brazil nuts a day or something are good for serotonin as well.
Okay, I didn't know that.
But actually, I had this fantastic, really exciting discussion with Peter Woollenburn about the power of trees.
Yeah.
And he came up with this great theory, which I'm using on every podcast to try and get it out there, that we are all holobionts.
Okay.
In other words, we're only partly human. We're full of bacteria, fungi, viruses, as is the external world.
Yeah.
And, we are so connected with everything around it. It's nothing woo-woo. I mean, I can be woo-woo, but this is just pure biology, and the more we're out in the natural world and gardening without gloves, the more that we are connected as we should be for our physical and mental well-being, because that is our evolution. So it's great to hear that from you as a GP and a medical scientist. So I'm going to check out that study from the Royal Marsden Hospital. Thank you. But I noticed that you're also a trustee of Green Fingers. Tell us about the charity.
Yeah, so Green Fingers is a fabulous charity. Big plug for them. If you've got a children's hospice in your neighbourhood, the chances are Green Fingers have built the garden there. So they raise money and connect garden designers with the hospices to provide a beautiful garden for children with life-limiting illnesses. but also for their families and their carers and the staff in the hospices to actually find a place to, number one, de-stress, but number two, be somewhere beautiful, connect with nature as well. So a typical Green Fingers garden is lovely. It's got no problems in terms of accessibility and mobility. It might have some play areas and some wildlife areas, but it's beautiful, and it's a special place to be that acts as a refuge when people need it most. So yeah.
So finally, Dr. Richard, what's your dream scenario?
Okay, the dream for me would be that as widely available as every district general hospital, that the NHS has a chain of therapy gardens, so that it becomes part of the landscape in a way that you could expect. So it's not just a nice to have. These are core provisions for the health service, both hospital-based and community-based gardens, but with therapists working with people for all the reasons we've said, so that gardening actually is part of the health of the nation.
Thank you so much, Dr. Richard Claxton. That was so interesting. Thank you.
Thank you for having me, Sharon.
Next week, we've got a Christmas special with Dr. Gabriel Henry, and we're going to discuss his latest book, The Tree Almanac 2024. And because it's Christmas, we're going to have a really lovely festive episode.
And just before we go, time to tell you about our very exciting new conference in February 2024.
Trees, planning and construction. Is it really working? Do you feel isolated? Well, this conference plans to change that. We're here at BS 5837 Speed Briefing. Biodiversity net gain. What does it mean for trees? And trees and planning law. Are you up to date? Sarah Dodd will tell us. Hear from keynote speaker Keith Saker and Jeremy Barrell. We'll hear the views of London Tree Officer John Ryan on what works well and ideas for the future, and a panel of experts, a planning consultant, highway engineer, demolition contractor and building contractor, and I will be saying what works for me. All this and outdoor demonstrations on the 20th of February 2024 here at Braxted Park. And thanks to our headline sponsors, Bartram Trees, we're offering cut price tickets for tree officers. See us at Sharon Hosegood Associates /training or Eventbrite Trees, Planning and Construction.